Hi, I'm Dr. Bryan and welcome to the third video of my short series on frozen shoulders. Now in my previous two videos, I discussed what a frozen shoulder is, what you can do for yourself if you do have a frozen shoulder, and what kind of injections are available to you if you happen to see a doctor for your frozen shoulder problem. Now, if your frozen shoulder happens to be very persistent and very stubborn, I'd like to discuss what kind of procedures your doctor can do for you to treat you. So let's get on with it. Well, here we are back in my kitchen again. Now in my previous video, I had used a frozen chicken leg to show you what a frozen shoulder actually is. But I've already cooked it and I've already eaten it. But don't worry, I've prepared more chicken leg for you because there's nothing like some good protein. Now I'm going to use this chicken leg to show you what kind of procedures can be done for a frozen shoulder if you do have one. Now the two most common procedures done for frozen shoulders are the manipulation under anaesthesia, also known as the MUA, or the capsular release. Now as a disclaimer, I really do not like the MUA and I almost never perform it by itself. But it is a very effective procedure nonetheless, and it is very well studied and still performed by many orthopedic surgeons, so I'll still discuss it in detail over here. So in an MUA, the goal is to move the shoulder joint beyond its current range, and in doing so, rip the capsule of the shoulder so that the patient gets movements in the shoulder straight away. What is done is that the patient is put under anesthesia so it does not feel any pain at all, and the doctor then takes the arm and just gently moves the arm, and I'm gonna demonstrate it right now. So as you can see, I'm moving the shoulder and just gently move it more. And as you can see, movements are getting there now. That's very good. Oh! Oh. Oh no, did you see that? I broke the shoulder. Can you imagine the patient goes under anesthesia and your doctor comes to you and says, look, good news and bad news. The good news is that your arm is moving very well now. But the bad news is that I broke your arm. What a disaster. And this is the reason why I do not like MUAs, and this is the reason why I never perform MUAs. So a capsular release, which is what I do, is the much safer option. I've got a plastic model over here. This is the scapula, which sits at the back over here, and this is the arm bone that sits over here. And in this model, I have colored the thickened, inflamed capsule in red. Now in a normal shoulder, there are of course muscles covering the whole shoulder joint and the capsule. So what does a capsular release involve? Well, it involves making a very tiny incision, about 4 millimeters long, at the back of the shoulder. From here, I will then put in a camera so that I can look at the joint from the inside out. And from the front, we make another very small incision, just 4 millimeters as well, so that I can put in an instrument through the muscles. And by making a very small incision, it hardly damages the muscles at the front of the shoulder at all. And since I've got a camera on the inside, I can actually see the whole capsule, and using that, I can then use a special instrument. In this case, I'm just using a pair of scissors, and I can then make cuts in the capsule exactly like what I'm doing now. And by doing so, I release the capsule of the shoulder joint so that movements are now very much possible and is no longer all gummed up. So this procedure is not only safe, but it is also fast to perform. It can be done as quickly as within 1 hour. And the best thing is, the recovery is also really fast. I've had patients who have recovered within 1.5 months. Can you imagine recovering in 1.5 months rather than slogging away at physiotherapy for 1.5 years? So in summary, a frozen shoulder is a condition where the covering of the shoulder joint, also known as the capsule, becomes very inflamed and very thickened, and as a result, shoulder movements are very much restricted. So in most patients, all you need to do is to do some physiotherapy, and the frozen shoulder will usually resolve within 1.5 years' time. Now as a disclaimer, I'd like to remind you that if you do suspect that you've got a frozen shoulder, please do see your doctor to confirm the diagnosis. So if pain is very severe in your case of frozen shoulder, certainly seeing a doctor can be very helpful because there are injections that can help you. Now, the main injection will be that of a steroid injection delivered right into the shoulder joint. It is very safe and very effective in helping you with the pain but the stiffness will still be there and you will still need to do physiotherapy to get the shoulder moving again. Now, if stiffness is the main issue in your case, then, as I mentioned earlier, a capsular release is not only a safe but very fast option that you can explore, although it does involve a minor surgical procedure. Right, I believe these videos have helped you to understand a little bit more about frozen shoulders. Now, if you've got any further questions, feel free to drop me a comment, or even better yet, come by and see me in my clinic. Now, in my next video, I'll be taking you through some exercises that you can do in your office if you do have a frozen shoulder. Also, if you have found my videos useful, please share with your friends. I'm Dr. Bryan, and I'll see you when I see you.